Welcome to the RRPS Health Services presentation on Understanding the Student with Asthma. This program was developed from the NASN program Managing Asthma Triggers. Many thanks to the nurses of Rio Rancho Public Schools for their help with the development of this program. After viewing this presentation, you should have a better understanding of students with asthma and how to help the students succeed in the school setting. In today's training, we will be discussing some common symptoms of asthma, asthma triggers, or things that can set off an asthma attack, the management goals you'll use in the school setting, and everything you need to know about the different medications students use to treat asthma. Asthma affects some 9 million children. It's a chronic inflammatory disease of the airways. It is thought to be responsible for at least 25 to 60% of all school absenteeism. It's important for children and adults to understand that the disease is not contagious. New cases are increasing at an alarming rate, especially among inner-city minorities. In early childhood, more boys than girls seem to have asthma, but by the teen years, the numbers become more equal. There is no definite genetic link, however, it does tend to run in families. Managing asthma triggers can help reduce symptoms. Triggers, or airway irritants, can cause hyperactive airways to react. Medications can also help in managing symptoms brought on by exposure to an irritant. With proper control of asthma, children should have minimal or no asthma symptoms. People with asthma have hyperactive airways. Their airways react to triggers that cause the lining of lungs to swell, mucus to form in the airway, and smooth muscles of the bronchi to tighten. The result is narrowing of the airways. Less air can move into the chest, so a person with asthma may feel short of breath and experience chest tightness. Asthma symptoms and triggers vary from one person to another. Some children have asthma symptoms only occasionally, some have symptoms almost all the time. Some just have feelings of being tired. So if a child has asthma, what does it look and sound like? Air moving through narrowed passage makes a whistling sound called wheezing. The person may cough in an attempt to rid the airway of mucus, and if the student cannot speak, this is an indication that they are unable to move air well enough through their lungs. This can be very frightening for the person experiencing the symptoms, and this anxiety can cause the symptoms to become worse. Common asthma triggers and irritants include exercise, cold weather or changes in temperature and humidity, irritants such as smoke from cigarettes, wood-burning fireplaces, strong odors, and air pollution, allergens such as pet dander, dust mites, cockroaches, molds, and pollens, medicines or chemicals, coughing, yelling, or laughing, and acute stress. More than one trigger may be required to initiate a response. However, one may be all it takes to set a very definite response in motion. Triggers may change over time, and the severity of asthma reaction or episode can also vary. The management of asthma in the school setting are maintain normal activity, maintain normal lung function, prevent troublesome symptoms, prevent recurrent episodes, and minimize medication side effects. Relievers are medications classified as bronchodilators and are used to open the airway by relaxing smooth muscles. A commonly used medication of this type is an albuterol inhaler. Inhalers open airways fast and are useful with exercise-induced asthma. Controllers are anti-inflammatory medications that are used to reduce swelling and decrease mucus production. Commonly used inhalers are Vanseril, Beclovent, and Aerobid. Other oral steroids are used to control inflammation in asthma patients. These medications will not provide immediate relief, like bronchodilators used during a severe reaction. Management of asthma in the school setting provides a challenge for students, parents, and school staff. First, students with asthma need to be identified. Not all parents and students with asthma will reveal to school staff that they have this condition, so it's important to know the signs of asthma and recognize the symptoms early. If the parent has indicated their student has asthma, the school nurse will investigate the triggers, if the medication has been prescribed, and possibly write a health management plan if the condition warrants. A copy of the student's health management plan will be provided to the appropriate staff for review. The school nurse will be responsible for this process and will work with the student, parents, and staff to make sure all parties are aware of the student's condition and what steps to follow if problems arise during the school day. A cough may not go unnoticed, but wheezing is more discreet, and tightness in the chest is likely to be recognized only by the person experiencing it. Coughing as a rule will not resolve an asthmatic's congestion. Restlessness and onset of anxiety are the first indicators of an asthmatic reaction. These can easily be misinterpreted as misbehavior. Older students should be aware of their symptoms and report them quickly, but young students present a unique concern and everyone needs to be alert. Students with recurring coughing episodes and complaints of "I can't breathe" should be sent to the school nurse with an escort for further evaluation. Some students are allowed to carry their rescue inhaler with them and use as needed per their physician's instructions. If your student has an asthma health management plan, follow the instructions on the plan. If your student has an inhaler with them, first check with your school nurse to make sure they have permission to self-administer the inhaler as needed. If the student does not have permission from their physician to carry their inhaler, the nurse will need to keep the child's inhaler in the health office, and the child should come to the nurse for their medication during the day. If your student has permission to use their inhaler without the supervision of the nurse, and you notice signs that they are having trouble breathing or the student indicates they need to use their inhaler, then follow the following steps. Have the child sit up and rest. Let the child administer their inhaler. Typically, physicians order 1 to 2 puffs. You may need to remind the student to wait a few minutes between puffs to help the medication work properly. Observe the child for several minutes. Ask the child if they feel improved enough to return to the activity. If they indicate they're improved, have them return and continue to watch for breathing difficulty. If they have not improved after using their inhaler but feel like they can get to the nurse's office without difficulty, send them to the school nurse with an escort and their inhaler. If they continue to exhibit breathing difficulty or symptoms worsen, call the nurse to come and evaluate the child. If the student has breathing difficulties and does not have an inhaler with them, you may want to call the nurse for instructions. If the student is okay to walk to the health office, the nurse may want the child to come to the nurse's office with an escort. If there's concern that your child cannot make it to the health office, then ask the nurse to come and evaluate the student. Have the student rest quietly, sitting in an upright position, and remain calm. Never underestimate the power of a reassuring voice. Stay with the student until help arrives. Early recognition of asthma signs is the most important step in managing asthma in the school setting. Knowing the students with asthma and their asthma triggers are important in the prevention of a seriously escalating attack. Working closely with parents and the school nurse is a key to student success in school. Always listen and act on students reporting shortness of breath. Consulting with your school nurse is the best plan to keep students with asthma safe. Thank you for your attention during this brief training. There will now be a short quiz to help you focus on the main ideas of this presentation about asthma. After the quiz, there will be a slide with some reference information you can write down. Again, this training was developed by the National Association of School Nurses and modified for use by the Rio Rancho Public School staff. If you do not pass the quiz, you can always retake the training for a better score, but please do not exit the training in the middle of the quiz. Here we go.